So good morning. Today I'll be presenting a case which I felt was quite interesting to me because the patient presented with something which initially we could not understand, but later we found that it was an intraocular as well as extraocular part of the tumor. He was a 51-year-old male when presented with diminished visual acuity for 6 months and a bit of swelling in the left eye for about a month. By local consultation, he was diagnosed as a case of diffuse choroidal hemangioma with secondary glaucoma and was started on timolol combination Dorzox T and other eye drops. He was also non-hypertensive for 5 years with erratic treatment compliance. No other significant systemic complaints were there. MRI T1, T2 waited and ultrasonography was done at the local images. So I'll start with the examination first. There was a bit of fullness in the left periocular area. Now dew-like lesion in the inferior lateral area of the left lobe was there. The right eye was within normal limits. His best corrected visual acuity and other things was all fine in the right eye. The left eye had dropped visual acuity to 624 and there was RAPD was positive with early PSC changes. On fundus examination, right was within normal limits, whereas the left showed a diffuse choroidal thickening and folds with pigment dispersion at places. Initially, we thought that we are dealing with something which is intraocular, but when we got the ultrasonography done, apart from the intraocular lesion, we could see here there was an extraocular extent which was just next to the optic nerve here, which raised suspicion to us and which had our ears on that we are dealing with something extra than something in the choroid. So the fluorescein angiography was done, which shows early hypofluorescence followed by the late hyperfluorescence into the choroidal areas of the left eye. You can see this in the collage. The OCT also revealed the right eye was normal, the left eye revealed that there was an elevated choroid and there was a mass lesion below the choroidal stuff. So we were dealing with a choroidal lesion. Now the MRI suggested there was a hypointense on T1 and hyperintense in T2. There was also an extraocular lesion with lateral rectus thickening. You see this, there is an extraocular lesion just next to the optic nerve there, and also there is thickening of the lateral rectus muscle. So that was something confusing because we were thinking what are we dealing with. There were few diagnoses because of the pigmentation. We also kept melanoma there in our brains, ocular lymphomas, choroidal hemangiomas, choroidal secondaries, posterior scleritis and whatnot. Choroidal melanoma with orbital extension was our working diagnosis when we proceeded with it. The history was revised, but there was no history of sudden or rapid weight gain or loss, associated pain, tuberculosis or similar complaints in the past. No pigmented lesion in any part of the body. Investigation requested were chest X-rays, ultrasound abdomen and CT scan abdomen to rule out any systemic pathology. Maybe we are dealing with something secondary in the first go. Everything was within normal limits. So what next? We thought of taking a histopathological diagnosis on the basis of incisional biopsy. So I conducted the incisional biopsy through the conjunctival approach and explored the retrobulbar area, and the pigmented lesion which was seen was biopsied. It was sent separately for histopathology. The lateral rectus and the orbital mass was sent separately. It came out to be a lymphoproliferative lesion of the orbit, suspicious of low-grade non-Hodgkin's lymphoma of the left eye. And IHC was done for confirmation. It was diffuse strong staining with CD20 and BCL2 and most lymphoid cells with CD3 staining, a few dispersed lymphocytes. So now we were sure that we are dealing with NHL and low-grade B-cell lymphoma favoring extranodal marginal zone or mild type of lymphoma. So the follow-up was done on 3 weeks. There was a bit of increased choroidal thickening with inferior exudative RD, probably because of the intervention we did. This is the ultrasonography. So we ruled out any systemic involvement again. The bone marrow biopsy was done, which was within normal limits. The patient was sent for radiotherapy on the basis of a histopathology report. After 2 cycles of EBRT, his choroidal thickening started decreasing. Follow-up slides show this collage, which was better. His improved vision was 624 No exudative RD was seen on fundus examination in the left eye thereafter. OCT also showed that the choroidal lesion has subsided. So a well diagnosed case, you can dwell with the patient, and nicely conducted radiotherapy came to the salvage of the patient. The vision dropped because of the radiation induced cataract, which was later done, and the patient was post-operative 6 parts with a mild radiation keratopathy. The patient has now, after 3 years, his vision was still 6 part with all the investigation within normal limits, and patient has now completed around 15 years with me after post-operative findings. He is absolutely fine. I will skip the discussion with the sake of the timing. Thank you very much.
Thank you, Dr. Mittal. That was fantastic. It's like for choroidal lymphomas, we rarely see such a presentation, and the B scan was so nicely showing the extrascleral involvement. And so I'm assuming at that time the systemic workup was also negative. So
yes,
EBRT was the choice of
yes,
treatment.
it was negative. It was negative all over.
Okay.
Even thereafter also we repeated the systemic investigation. That was again negative.
Yeah.